afternoon, and thank you for joining us for this community briefing today, and thank you to Margie Prop for providing interpretation services. Access to affordable and quality housing for every resident is a key component of my administration's One Lincoln initiative. Last week, I announced that we have set an ambitious goal to provide 5,000 new or rehabilitated units of affordable housing in Lincoln over the next 10 years. Beyond affordability, the city is also committed to ensuring that every family in our city has a safe and healthy home. This requires making targeted investments to improve the quality and livability of our city's oldest homes, which house many of our lowest income residents. To that end, I am excited to announce that the city recently received news that we have secured $3.4 million in U.S. Housing and Urban Development grant funds to support the expansion of our local urban development department's lead-based paint mitigation program, which eliminates lead-based paint issues in houses to address identified lead hazards. Mitigating the risk of lead poisoning is important work as we seek to create a better quality of life for present and future generations. Any parent who has ever taken their child to the pediatrician's office has had to fill out that form that includes a checklist item about the age of your home, information that pediatricians take really seriously so they can be sure to test for elevated blood levels in young children. Lead-based paint is one of the most common sources of lead poisoning in children, and children under the age of 6 are especially vulnerable, and exposure can have significant consequences for their long-term mental and physical health. I personally can clearly recall how distraught a friend of mine was when she discovered that her toddler, unbeknownst to her, had been reaching through the slats of his crib to peel off paint from the wall and to eat it. I remember sharing in her dismay at the time and learning at that moment that apparently lead paint tastes sweet to children. So this is why it's a contributing factor to the problem of childhood exposure and contamination. Recognizing how much is at stake, the health and well-being of our children and the quality and safety of our homes, our city team worked diligently and collaboratively to secure these vital federal funds. Our successful grant application demonstrates the cooperative work of an effort spanning our Urban Development Department, the Lincoln-Lancaster County Health Department, and Finance Department team members. The grant program also leverages our partnerships with community organizations to ensure the most effective application of these vital funds. This afternoon, I am pleased to welcome the U.S. Housing and Urban Development Great Plains Regional Administrator Jason Moore to Lincoln. Administrator Moore, the podium is all yours.
Thank you very much, Mayor. It's good to be here. Welcome. It's a great afternoon here in the capital city, and I'm pleased to be back here with your esteemed mayor. I think 2 summers ago I was here at the peer-to-peer symposium. That's the first time that I got to meet you. And like the mayor said, I am here to bring a grant of $3.4 million here to the city of Lincoln of the lead hazard reduction on healthy homes, a grant. I know the city will be using this money to remediate over 70 units. And they'll be working with medical and social service providers to have them reach out to families with young children to make sure that those children are safe from lead-based paint and other health hazards that happen in the home. This has been a top priority of this administration, and especially my boss, Secretary Carson, who is also a doctor, and he knows firsthand the effects that lead can have on young developing minds. And let me also say that I know that this will be a top priority of the city of Lincoln to get this money out and to use it. So I want to applaud the city's effort to ensure that these children have every opportunity to healthy development. Lead exposure has 2 distinct qualities. First is its intensity, which is so severe that it can have crippling and long-term effects. Second, its invisibility, as it can go unnoticed by those directly affected. That's why testing lead in children is so critically important. While unhealthy and unsafe housing affects millions of people from all walks of life, we know that children, the poor, minorities, and people with chronic medical conditions are disproportionately impacted by unhealthy homes. As may be obvious, low-income families are more likely to lack the resources for preventative measures in the home, and deferred maintenance can lead to the development and persistence of residential health hazards. But the work begins in our communities and in our neighborhoods and in each home. It takes community engagement, public and private partnerships, and dogged focus about the outcomes with the help of our grantees and our partners. HUD has an important role to play in the connection between identifying and addressing health hazards that have an impact on potential health issues. So we want to be proactive, and we want to focus on prevention rather than just treating the illness. I want to conclude by thanking everyone here today that is involved in this effort, and I also want to remind everyone that HUD's Office of Lead Hazard Control and Healthy Homes offers a wide range of educational tools, products, and resources to assist our partners at all levels in educating our communities and maintaining our healthy homes. So congratulations to Mayor Baird and the City of Lincoln for taking this lead and for protecting our children and families in your community. Thank you very much.
Oh, thank you so much, Administrator Moore. This grant will really make a meaningful difference in mitigating exposure to lead in an area of our community with over 21,000 housing units were built before 1979. The grant funds provided will be applied in two distinct programs, as Administrator Moore mentioned. First, the Lead Hazard Control Program run by our Urban Development Department. They will apply this to properties within the target area and be conducted on eligible properties that are home to children under 6 years old with identified elevated blood lead levels. Work will include intake, inspection, risk assessment, clearance of eligible properties, lead hazard control strategies, historic preservation, financing of the interventions, relocation when needed, construction, education, and information effects and program evaluation. We anticipate over 65 individual properties could receive assistance through this work. In addition, our Healthy Homes program will address other residential hazards, such as mold cleanup, smoke and carbon monoxide detector checks and installation, lead-containing water supply replacement, and other unsafe or unhealthy conditions within the home. Our efforts will also provide lead hazards control training to local contractors and individuals to increase lead hazards control capacity within Lincoln. It'll also provide education to families on the negative impacts of lead poisoning on children, provide education to property owners and managers of lead hazards, and provide extensive outreach and education to the entire community on lead hazards control and the negative impacts of lead poisoning, particularly on children under the age of 6. As part of this effort, the city will maintain a lead-safe housing registry. That'll be on a dedicated webpage to help families with children under the age of 6 identify and secure lead-safe housing. And last but not least, our partners in the community will assist with the identification of children with elevated blood lead levels where they can be referred for medical treatment and access to the resources of this program. We are deeply grateful for HUD's support of our effort that will improve the health and safety of our youngest residents. And now I think we're going to have some fun with the presentation. After the presentation, we'll open it up for questions. Our Urban Development Director, Dan Marvin, is here, along with representatives from the Lincoln-Lancaster County Health Department.
Good in front of the podium?
Yeah. Thank you.
Add the two other folks.
Yeah.
Do one more.
Okay.
And, please.
Can you get it?
No, I'll do it.
Great. All right. Thank you. Absolutely.
Keep holding on to it. Do we have any questions from the media? Again, Dan Marvin's here from Urban Development. Scott Holmes is here from the Lincoln Lancaster County Health Department. We're grateful for their efforts in this process as well.
Hi, Mayor Riley Johnson, Journal Star.
Hi, Riley.
Hi. First question, what area of town generally are the 65 to 70 units?
I'll let Dan Marvin come up and specify that because his team has been working on this closely, but central Lincoln core of the city.
Riley, we identified, I think, 15 different census tracts. They meet qualifications for the grant application, which are income thresholds. They also will be doing work within opportunity zone areas. And they cover, I believe, a total of about 60,000 residents in the city of Lincoln. So that's a substantial portion of the city of Lincoln.
And for those that may be unfamiliar or just with this issue, how is it that in 2020 there are still homes in the city with lead-based paint?
Well, homes that were built primarily, you know, in the 1950s or before, but all the way up into the 1970s, did have lead-based paint. And you know, if you're like me, when you go in and you move into a house, you don't strip the old paint off, you paint over the paint. So over the years, what will happen is on thresholds, on windowsills, that paint will chip and then bring back to the fore the original paint, which was probably a lead-based paint. And it's those exposures that are areas that we need to remediate.
And how much outside of the 70 units, I mean, what percentage of housing built in that time frame sort of may still have problems? I mean, is this kind of a dwindling problem that the grant will help finish off, or is there still a lot of work to be done?
There's a fair amount of work to be done, and I think that this is a grant that we would, in all likelihood, reapply for. It's a 42-month grant, and we'll make assessments, but we've got a great partner in HUD, and we're hoping to be able to demonstrate to them that we're making progress, and that if we do reapply, that there is more work to be done.
And I had a general question for someone at the health department.
Hi, Riley.
Hi, Scott. To your knowledge, does Lancaster County have disproportionate rates of children showing signs of lead sort of in their system, or could you speak to the health department concerns for this issue?
You bet. So the state health department has been gathering data on lead in children's blood for several years. A couple of years ago, when we got information from them, we identified that there were basically hundreds of children in Lincoln that were getting lead poison from their homes. We began to work with urban development and others to try to start addressing this problem, putting the data together in a way, identifying the census tracts, identifying the blocks. And what we learned, Riley, was that within the core part of Lincoln, if you're a child there, you have about 4 times the chance of having a higher blood lead level than children in the rest of the community. That's a basic health equity issue that we're very concerned about. It aligns with the mayor's goals on both health equity and with housing. And we've been working with urban development and the finance department to move a grant forward to reduce those risks in children in our community.
To your knowledge, and maybe this might be a question for Dan, but do the homes span owner-occupied and rentals, or is it predominantly in rental property?
And the grant allows us to address both. You bet.
Any other questions from the media?
Hi, Mayor. This is Macy Meyer with Channel 8. Kind of a broader question, but we're already getting kind of a lot of concerns today about the announcement from Pinnacle Bank Arena that they're going to be hosting this Husker football party coming up on the 24th. And given kind of the current state of the city with the pandemic, we know our style was raised last week. Did they get this approved by the health department? And what was kind of the process of that, deeming it safe to have, thousands of people kind of come together?
I'll hand this off to Scott Holmes from the Health Department in just a moment, but I will say that the Lincoln-Lancaster County Health Department has been supporting the safe implementation of larger events in our community throughout the pandemic, and they do that in a very organized and collaborative manner. They work with people who want to host events over 500 people to make sure there's adequate spacing, that there is masking, that people are understanding the precautions they can take to successfully pull off a larger gathering. And we have seen this occur for both Lincoln Public School high school graduations, and of course the funeral services for our investigator Mario Herrera. So we do have a track record of doing this work, but I'll let Scott come speak to the specific instance you're asking about.
Good afternoon. I honestly do not know if we've approved this specific event. First heard about it today, and so, but we have worked with Pinnacle Bank Arena on multiple events. Tom Lorenz and his staff know what they need to do to provide protection for the community. They have held multiple events, and simply because the name Husker football is attached to this one should not all of a sudden create a level of concern that may not be warranted. We will work with them and we'll assure that social distancing is observed, that masks are worn, and that this event can be carried off in a safe fashion.
Thank you. I appreciate you guys elaborating on that.
You bet.
Any other questions from the media today? All right, well, we're so pleased to have some good news to share. Thank you again so much to the U.S. Housing and Urban Development Department for being here today to help us and support our efforts to keep all of our community residents safe and healthy and housed during this pandemic and beyond. Thank you.